cast are Klarynz B Alvarez as the vet nurse, Gerard Alvarez as the client or owner, and our dog Kila as the patient.
Good morning everyone, my name is Alvarez and this is my video about the roles and jobs of a vet nurse and also what they do in a day.
What is the role of a vet nurse? As a veterinary nurse, you'll be involved in the hands-on nursing care of a range of animals, providing both emergency and routine health care. You'll work alongside with veterinary surgeons to promote animal health and welfare. This is the life of a vet nurse.
A few moments later.
Hello, let's go. Hey, welcome to our clinic. And now we show you guys the roles of being a vet nurse. Administering drugs, anesthetics, and injections. Preparing animals for surgery. It includes bathing and shaving. Holding and monitoring animals during operations. Maintaining, sterilizing, and laying out surgical equipment. Cleaning up after surgery. Undertaking diagnostic tests. Preparing and sending off laboratory samples. Taking x-rays. Caring for animals. Exercising animals.
Honey bun sugar plum, pumpy umby umpkin. You're my sweetie pie. You're my cupcake gumdrop. Snickums, spickums, you're the apple of my.
Grooming animals in patients. Giving advice to the owners about caring for and breeding animals. Keeping records. Writing and filing reports. During surgery, necropsy, and euthanasia, it is important to give consent forms. Consent forms documents the understanding among the veterinarians, clients, and veterinary clinic, hospital of the specific conditions, risk, and responsibility of each party. It provides legal evidence that the healthcare team on behalf of Veterinary Clinic Hospital informed the patient's owner of the important information regarding the procedure and that the owner consented to this recommended and planned course of action. During vaccinations, every new patient must have a complete history taken, which is then updated every time the patient visits the clinic hospital. Just because you already know the patient doesn't mean you will no longer record its history again. Two scenarios of vaccination: considering the dog a month-old dog to have its first vaccine, or considering a dog a year-old dog to be vaccinated with 5-in-1 vaccine. We will focus on the scenario considering the dog a month-old dog to have its first vaccine. What should you do before the first meeting the client and the patient? We need to ask for the client's and patient informations and the patient medical history. The patient and the client information includes the name, address, contact number of the client. Special attention should be given to the proper spelling of the client's name and address. Includes the patient signalement, the age, breed, gender, and species. Noting the patient date of birth is preferred over just knowing its age. Patient medical history should include all prior history of the patient, diagnosed and undiagnosed diseases. Should include the patient vaccination history. Other information that should be noted: parasite control, dental health, and nutritional history.
Hi, good morning.
Good morning. What is the reason for the pet's visit?
Hi, good morning. I am here for his vaccination.
When was his last vaccination and who administered it?
Actually, I am a newbie here and this will be his first vaccination.
May I know his name, age, sex, breed, and color?
Hi, so this is Kila, a 1-month-old exotic woolly male, and his color is chocolate.
Always remember, ask questions pertaining to the signalment of the patient even if it's already noted on the chart or check-in form. Okay, please fill up the owner and the pet information. Thank you.
A few moments later.
This is our information.
Thank you. Has your dog taken any parasite control? Like deworming? If yes, when was the last one?
No, he has not taken anything yet.
How about his nutrition? Is there changes in his diet?
No.
Is there any history that he have illness or diseases? And if yes, is he taking medication or supplements right now?
No.
Are you aware of any conditions or diseases that the parents, grandparents, or siblings may have had?
Not that I know of.
Is there any changes in his behavior?
No.
How about his environment? Do we stay outside or inside the house?
He stays inside the house.
What should you do before you take the patient to the attending veterinarian for his or her vaccination? We must take patient's physical examination and also check his or her vitals. First, checking for the weight if it's emaciated, underweight, ideal, overweight, or obese. Checking for oral cavity. First, the teeth by lifting the lip. Capillary refill time. Press the gums. Normal CRT is 2 seconds. Tongue and throat by gently opening the mouth. Head exam. First the eyes. Check for redness, scratches or sores. Second is ears. Checking for earwax, sores or odor. Lastly, checking for nose. Checking for nasal discharges or swellings. Checking for thoracic cavity. Heart rate. Assume that I have stethoscope. Taking a dog's femoral pulse rate. Checking for dog skin system. Examine the skin and hair coat. Signs of dryness, excessive oil, redness or sores. Checking for hydration status. Gently pull the skin and then let it go. Lymphatic system. Mandibular lymph node, each side of the base of the jaw. Prescapular lymph node, in the front of each shoulder. Axillary lymph node, armpit area of forelimbs. Note, only sometimes palpable in dogs, but always palpable in cats. Superficial inguinal lymph node on ventral abdomen between the hind legs. Popliteal lymph node behind each knee. The urogenital system, checking for penis and rectal area. Take the rectal temperature. Disinfect the tip of the thermometer, mercury or digital with alcohol. Lubricate the tip with Vaseline or Kai gel. I will explain to you what we'll do after the first meeting of the client and the patient, and also I will explain to you what will you do after the vaccination. After the vaccination, we will give them the veterinary vaccination record book and put the due date when will they come back. After the vaccination, explain to the owner or educate the owner on what will he or she expect after the vaccination. Explain to the owner the common mild side effects of immunization. First, redness, mild swelling, and tenderness at the vaccination site. Second, decreased activity levels. Third, loss of appetite. Fourth, low-grade fever. And lastly, nasal discharge, sneezing, and coughing.